Hi, my name is Jalissa Nicole Black, and I'm interviewing for the Doctor of Occupational Therapy program at Nova Southeastern University in Tampa, Florida. My NSU number is N01660216. I would like to thank the admissions committee for viewing my video. It is an honor to be able to record this interview for you all. I love Nova, go Sharks, and I am so excited for you to hear my responses to the questions. Question number 1, why do you want to become an occupational therapist? How did you first become aware or interested in OT? My road to occupational therapy was not very clear-cut. I've always had an admiration for the healthcare professionals and what they do. During my undergraduate studies in psychology, I learned a lot about therapy and different interventions that therapists use to help aid their patients to get better. So that was like a different perspective to healthcare that I wasn't privy to before. I still didn't know what occupational therapy was at that time, but I was in search of a career that would encompass both my passions for healthcare and also therapy. After several years of working in education, I reached out to a mentor of mine who is an occupational therapist, and I asked, could I ask her a few questions? My main question was, what is OT? Like, what do you do? And my next question was, what makes you passionate about your career? I always saw her speaking highly of her career and speaking highly of her patients and what she did, and she seemed very passionate about it, so I was interested. I wanted to know more. She was very, very helpful and gave me a lot of information and resources to look over. From that point on, I made a decision that I was going to observe occupational therapists. This was long before, this was probably 3 years ago, so this was long before I considered pursuing a career in occupational therapy. I recall the very first day that I shadowed an occupational therapist and going home with this feeling that that was what I was meant to do. It felt right within me. I loved what I saw. I loved how it made me feel. I love to see the progression of her clients week after week and see their improvement, and them share their stories of how they started out with her not being able to grasp a water bottle, and now they're at the level where they can really get back to their normal activities of daily living. What I love about occupational therapy is that it encompasses more than just the physical aspect. It's also psychological, it's also cognitive as well. And that's what I really enjoy about occupational therapy. There's so much diversity, there's so many options within occupational therapy of the type of therapy you can choose to do. I love that about occupational therapy as well. You can work in many different settings, which I experienced during my observations and my research, and I just love the profession. From my experience in the education field, in the military sector, and also in the healthcare industry, I really realized that there was a lot of shortages of occupational therapists. And there's a lot of clients and patients who could really benefit from occupational therapy, but they just don't have the resources available to them to be able to seek OT. I would love and I hope to be able to help bridge this gap, especially in underprivileged areas such as where I'm from. Question number 2. In your view, how is occupational therapy different from physical therapy? From my viewpoint, occupational therapy differs quite a bit from physical therapy, although there are apparent overlaps. Occupational therapists do not solely focus on the physical aspect of a patient and their health. They actually seek a holistic view on patient care. They aim to help patients get back to their activities of daily living by encompassing their physical abilities, helping them with endurance to be able to get back to that physical function, but they also have a huge role in the cognitive and psychological aspect of healthcare as well. Another way that I feel that OT stands out from PT is that occupational therapists have the responsibility and the freedom to be very creative with their therapeutic techniques, whereas physical therapy follows a lot of the similar paths to be able to get back to function and motion. Occupational therapists are allowed to think outside of the box and come up with creative ways to help their patients get back to being able to function in their activities of daily living. That is the main goal of OTs, is to help their patients engage in those activities that they're fond of, and I want to be a part of helping them too. Question number 3. Why do you want to get a doctoral degree when the current entry-level requirement is a master's degree? The field of occupational therapy is forever evolving, and to me, I feel like a doctoral degree is requisite for what I hope to accomplish within the field. As a Doctor of Occupational Therapy student, I will receive additional preparation in theory, research, and fieldwork, while also gaining ample experience in policy, mentorship, and leadership. Question number 4. Where do you see yourself 10 years from now? How do you see the Nsu Otd program as helping you achieve these goals? Although I'm not certain what pillar of occupational therapy I would like to work in, as I love working with diverse populations, however, I believe 10 years from now, I can really envision myself being the owner of a pediatric outpatient clinic in an underserved population, such as where I'm from, my hometown of Moultrie, Georgia. I would also like to help aid future practitioners as well, so I would definitely like to act as an adjunct professor at some point in my career. Within the field of OT, there are many pillars, as I stated, and that I could work in, and I love that flexibility of that. I love the freedom and diversity that OT has to offer, and that I'm not limited to one setting or to one population. I can work with anyone across a broad spectrum, and that's what I'm very hopeful for. Hopefully NSU's OTD program will help me navigate where I would like to begin my career, and we'll see where I end up in 10 years. During my observations, I experienced entrepreneurship, and I really enjoyed the possibility of someday being able to have my own practice. I love the freedom of that. I've also worked in education for several years now, for over 4 years, and that is work that I really enjoy and I'm passionate about. I'm passionate for developing rapport with learners, young learners especially, and aiding in their growth and independence. Question number 5. What do you know about the NSU Tampa entry-level doctorate program? What are your reasons for wanting to attend this program versus other programs? I love that NOVA's entry-level doctoral program is a hybrid program. I have experience at NOVA as a graduate student, and I love having my classes online and the flexibility that it allows. To me, this learning model allows a broader diversity and culture of the student body because they come from far and wide all to attend the same classes, and that's really awesome to me, and that's one of the things that I love. From personal experience, I do feel like my education at NOVA exceeds many other programs. NOVA continues to be a dominating force in the healthcare industry. NOVA itself has so many healthcare programs compared to a lot of other educational institutions, and this shows that NOVA has a desire to be a leader and an innovator within the healthcare sector. I've thoroughly enjoyed the faculty that I've had the privilege of working with along with my peers. They come from far and wide. NOVA has a reputation that is known not just nationally but internationally as well. Love that the faculty to student ratio is very low. This helps aid in a very comfortable yet personal experience of studies. NOVA has one of the 2 programs in Florida that are accredited. This shows that NOVA is ahead of the game and they have such an ambition to lead the way in the development of the profession. Question number 6. Please describe your experiences with online learning. What do you think it takes to be successful when attending online classes? As previously mentioned, I am currently a graduate student at Nova Southeastern University pursuing my Master of Science in Science Education. Therefore, I'm very versed in Canvas, which was originally Blackboard before, and go-to trainings in the entire online experience, as my master's level program is completely online. Although this program is completely online, it does allow us to apply our learning within our own geographic location. So I have been working with several schools that are actually in my county that I currently reside in, which I also love. In order to be successful as an online student, I do believe it takes organization, communication, time management, and determination. You have to be a proactive learner and really heed responsibility for your own studies. It's a lot of independent work, and it's up to you to make sure that you meet those appropriate deadlines and that you make it to class on time and that you're aware of what the future endeavors hold and that you're prepared ultimately. And you also need to be able to communicate with your professors and your peers if you're going to be absent or if something is going on that they may not be aware of. If there's any difficulties that you're having, you need to be open with your professors and communicate with them. And from my experience, I have found that they are more than willing to help you and any way that they can. Question number 7. What does the phrase taking responsibility for your own learning mean to you? To me, taking responsibility for your own learning means making your understanding a priority for you. Your professors will, of course, provide you with the foundation of your learning, such as lectures, textbook, notes, assignments. However, it really is up to you as a student to build upon that foundation by seeking additional resources that you require, adapting your studying methods to your personal learning style. I think that that is very important. You are going to be your biggest advocate when it comes to your studies. Question number 8. Describe why cultural diversity and subsequently cultural competence is an important consideration in the field of occupational therapy. Cultural diversity and cultural competence are important considerations in OT as we all come from various backgrounds, socioeconomic statuses, educational levels, geographic locations, etc. It is key to ensure that no matter the cultural differences that your patients are educated on their treatment and possess the understanding in order to develop rapport with your clients. As a clinician, I can't stress enough that you must possess those skill sets that allow you to empathize and relate to others. I myself come from humble beginnings. I am from a very small town, raised by a single mother. I was a first-generation college student before becoming a first-generation college graduate. And growing up, a lot of resources were very limited. As I previously mentioned, occupational therapy was one of those fields that was very limited and still is to this day. I would hope that others recognize the importance of variation in culture and upbringing and use that as an opportunity to really expand their horizons to various opinions, thoughts, ideas that you may not be privy to otherwise. If you stay in a bubble, you don't allow yourself to expand, you won't be able to really get into the core of what's going on with someone or be relatable. And I think that's what, as clinicians, we would aim to do, is to connect with our clients and our patients. That's the only way that they're really going to be able to get better, is if we can find the root of the issues and really discover what it is that makes them happy. And also, I feel like you have to have a passion for that, and you should want to expand what you can do within the field to across all cultures and not have limitations on that. Question number 9 is a scenario. After taking a very hard exam, you find out that several of your classmates got a copy of the exam ahead of time and did very well. The rest of the class failed the exam, including you. The instructor informs the class that she will not curve the exam because of the students who did so well. What would you do? I would definitely value the honor code, and I would encourage the students that I know of that had access to the test beforehand to come forward. Even though I know that that would be challenging for them, I feel that that would be the best thing to do. I would also inform the professor that I heard the exam was compromised, which is also tough. I would not purposely single any one person out because I won't probably know everyone who was privy to the exam. However, I would definitely inform her that the exam was possibly compromised, and hopefully that would help aid in possibly reconsidering her decision. But at the end of the day, I have to actively take responsibility for my own learning. I failed the exam because of my own merit. Even though the other students had access to the exam beforehand and that allowed them to pass, there was clearly a misunderstanding within my own knowledge that led me to fail the exam. And I do have to take responsibility for that, especially being that, NOVA believes in taking responsibility for your own learning. If I didn't understand the material, it was really my job as a student to notify my professor beforehand that I wasn't understanding the material and seek additional help and resources to ensure that I passed the exam there shouldn't be a need to cheat or have access to materials beforehand in order to pass your exam if you are following the notion to take responsibility for your own learning. Question number 10, scenario 2. You are working in an outpatient clinic and a client of yours who has hand surgery is not making good progress. Her surgeon has a poor reputation in the clinic. One day the client says to you, "I don't feel like I'm getting better. Was my surgeon any good?" What do you consider in attempting to resolve this ethical dilemma, and what would you say or do? I would seek to show empathy towards the patient and really listen to their concerns and take them into consideration. I would inform the patient that they have a responsibility to themselves to be an advocate for their own health. Therefore, if they do have concerns that they're not getting better, I feel it would be in the best interest of the patient to ask the surgeon questions about their care and act as an advocate for themselves, because from the surgeon's perspective, they may see improvement that the client isn't seeing. A lot of times patients want to get better quickly, but they may not be taking the necessary steps at home or independently to also improve their care. So I would definitely take what they're saying into consideration and notify the surgeon and ask if we can discuss alternative methods of care with the patient. I would definitely want to inform the physician of what to expect when they come into the room so that they can know that the patient isn't necessarily happy with their level of improvement at this point, and see if there's anything else that they can do. Even physicians sometimes lack certain knowledge on the resources that could be available to some of their clients. I know that within the sector that I work in, which is wound care, is podiatry, but I specifically work with a lot of wound care patients. A lot of them get referred to home health care, and physical therapy is often included in the home health care. However, occupational therapy is also an option, but it's not used as often. So you could simply notify your surgeon on what to expect when they're entering the room, but also if you know about some other methods or things that they could possibly try, you could suggest it to the physician, not undermine him and just go straight to the patient and start discussing their plans of care, but discuss it with the clinician, and then he can make or she can make a decision on what they see fit moving forward. Question 11. Describe your strengths and identify areas in which you need to grow. I would say among my strengths are my abilities to problem solve, my organization skills, and my passion for collaborative care. I aim to be compassionate, considerate, and empathetic towards others, and I love to work as a member of a team. An area in which I have sought growth would be to be an effective communicator in times of high stress. I naturally become very calm during strenuous activity. I kind of enter a mindset of autopilot mode. I've come to learn that not all members of the team respond the same way that I do, and sometimes during strenuous activity, members of my team really need more support, and I want to work on really effectively communicating my plan to the team so that they can feel not only supported, but we can all be on the same page moving forward as how we're going to accomplish our task and get everything that we need to get done to have a successful day. Question number 12. There are a number of applicants waiting to be interviewed. Why should we take you? I feel I would make a great asset to your program because I do have experience coordinating interventions, collecting data, and collaborating on academic goals. I also have clinical experience working with diverse populations and using ERM systems and having direct patient care. I have a passion for the field of occupational therapy and a desire to advance within the field. I have experience in graduate level studies and online communities of learning. And ultimately, I'm a proud shark and I love my school.